I'm Dana with Frequency555.com. I'm here with Dr. Jason Hartman, and we're at PCOM, and he's been working with me for about a year and a half, 2 years, and we're here to do treatment. Osteopathic manipulation, or OMM, and also acupuncture.
Kind of like watching grass grow. We've seen the popliteal fossa, which has fascial connections up into the pelvis, directly up into the pelvis. So as they free this up, it'll kind of open up this these fascial planes or the deep pelvic floor, where she has restriction because she has an increased structural lordosis in her back. Relax. Always, I mean, so much of her life is involved in engaging that musculoskeletal system. So a lot of the techniques look a lot harder, a lot of stretching, a lot of myofascial release, high velocity techniques where we will adjust the spine. But then some of the techniques do look like grass growing, where you're tuning into the more subtle mechanisms in the body. It's all one unit, right? It's not body or mind or spirit. It's body, mind, spirit. So as you treat one, you treat the other. So that's why you see people go through huge somato-emotional releases where after a treatment, an old trauma that's been there for a long time, and we just saw this with the last patient, is she left and she just started crying. Because we released stuff that was so deep in her body that it couldn't be, you know, that when you get that point, it's like lighting a spark or something, like lighting a candle. You know, sacral therapy comes out from an old osteopath named Will Sutherland, and he came up with this idea that you can actually feel the cerebrospinal fluid flowing up and down the spinal cord, and the bones, the membranes, everything kind of played into this flow to make this mechanism. And that if you could tap into that flow, you could release deep head strains, neurologic strains. You could work on kids that way. The more subtle arts, the cranial osteopathy, the more we listen, the more we're able to tune in to something deeper, a deeper process that's happening. And that process is microcosm, macrocosm in that relationship. And our ability to tune into it, it's like we're like a television dial, we're like a radio, and we can tune our tuner to that frequency and listen to that connection. And there's some people who haven't been shown that connection yet, or that frequency exists. So if you can open them up to it through a treatment or through one experience, it'll change their life. Pull the cat's tail, where does the sound come out?
The mouth.
Right? So, do you want to tape the mouth shut? Or do you want to stop pulling on the tail? You cut the nerve, you give them an opioid, you drug them up, you give them, you knock them out. You don't feel pain if you're knocked out. But you really have to find the cause. And that's at the root of any good health system, any good healing system, whether it be acupuncture, Ayurveda, osteopathy. It's to find the cause. And there's nothing wrong with giving some drug to make the symptom go away for a little while, and that's the beauty of technology. And if you can fit that technology or fit that reductionist mind state into a bigger philosophical system that is holism, that understands the whole and understands how to treat the whole, and that this is only a little piece, but it will tie back into the whole, then it's all right. You know, there's a time and a place for everything.